Welcome to the Relationships Inside Out podcast with Doctors Gregory Siebert and Kimberly Murray, licensed marriage and family therapists. Join them on this journey as they explore the ins and outs of relationships.
Well, welcome to Relationships Inside Out today, where we have a very special guest, Tracy Main, licensed professional counselor and registered play therapist.
Welcome.
Hello.
So Tracy, why don't you start by telling us a bit about you, how you came to this field, what you do, all the things.
All the things. Let me unpack all the things. Okay. Let's go with the professional question first, I guess. How did I come to this field? Let's see. Well, I started out not wanting to work with kids, believe it or not, and I fell into it. When I was doing my master's degree, I don't know, about 10 years ago, I started working as an ABA therapist just to kind of get some part-time work. And I was trying to find some fun way to engage the kids that wasn't so dry, like try to really incorporate some play in there to kind of get them motivated. And I just started dabbling in it, and then got a internship working for an autism diagnostic center in Louisiana when I lived back in Louisiana. And the ladies, they were like, yeah, there's a thing called play therapy. I was like, what? Tell me more. So I delved into that after I got my license and did all the extra certifications. And yeah, it's been a work in progress since probably 2015, and then I got fully credentialed in the year of COVID 2020. I've been doing it ever since.
And she's a total badass at it. So let's just be really clear about that too.
Yeah, share a little bit about what play therapy is from the outside, and we get like parents who are like, we don't know what's happening. What is this? But it's very effective. There's a lot of research on it. So share with us what is play therapy?
Oh, that's a lot of unboxing too. So basically, more or less, if I were talking to a parent to explain this to them, I would say, hey, kids don't process the same way we do as adults. Their brains aren't fully developed yet. That prefrontal cortex is not fully there. That's the part that's responsible for like a lot of that logic and reasoning and verbal processing. It doesn't really fully start to come online until your 20s. I don't know if you remember your early 20s and how maybe emotionally tumultuous it may have been. But yes, so a lot of pieces aren't developed yet. So we say the best way, the most developmentally appropriate way of working with kids would be to use their natural language, which is play. The idea behind that is people much smarter than me with advanced degrees, wonderful man by the name of Dr. Gary Landreth, has this tagline of, play is the language and toys are the words. So the toys and how they play and what they do with it are what we use in that therapeutic setting to be able to reach those goals and attain them.
That's awesome.
Yeah, that's very interesting. And when you're there as a therapist, what are you looking for? Like, what are you observing?
What are you doing?
Yeah, what's it look like, right? Like, I guess like what like a play therapy session might look like.
Yeah.
There's so many different ways of doing play therapy, the same way other, like, the therapy and counseling world is. There's DBT, there's CBT, there's parts work, there's couples therapy. So play therapy is no different from that. There's different modalities within it. All that just to say that when I am doing a play therapy session, a lot of the work, what I base my work on is a lot of child-centered play therapy, Adlerian play therapy, and synergetic play therapy. So what, without going down too far of a rabbit hole and exactly what all those mean, is all to say is that play therapy is different for every child. It's not a cookie cutter approach. So when kids come in the room, like you can kind of see the room behind me. This is not an office. This is a play space. So kids get to come in. And of course, this is after we've done an intake with the parents. Kids are present for that piece. But their first session, they get to come in the room, they get to explore the room, to kind of just lay out some groundwork, saying, hey, like, this is your space. You get to use it the way you feel you need to, kind of like your own room. Don't set limits unless I have to. It's usually for safety purposes. Or if something might getting broken, or if there's like a therapeutic limit that needs to be set. But a child gets to come in here and explore the things that are in here. I use their interests and what they're drawn to be able to address their the behavioral or emotional goals that their parents want them to work on, which might be different, by the way, from what the kid actually wants to work on. But they come in here, they get to explore. The first couple of sessions are really core and relationship building, and it's really like what I am doing in the room is I'm doing a lot of tracking and reflecting of like content and emotion as they're working through their play. I guess the next question begs to say, like, what does that actually look like? So if a kiddo is coming in here and they are frustrated that day, they might be gravitating towards some of the toys in here that help express that frustration. So for example, for anybody who can see us, I've got this big old spot right here. Kids work with this, doing a lot of physical play, some aggressive play. So I'm tracking that. I'm watching them doing what they're doing. I'm noticing what's happening in their bodies, like their breathing, their facial expressions, how they're working with this. So it can kind of look like kiddo comes in here, starts tackling this thing. I'm tracking that intensity. So it's like, whoa, that's big today. You really need to throw yourself at that. Yeah. And like they might pretend it's something or someone and they might hit it, or they might be verbalizing something towards it. So we're tracking all that stuff as they're doing it to help integrate some of that intensity.
I love that. And for those who can't see Tracy, so if you're not watching it on YouTube, if you're listening to just the audio, some things that are in her office might be like sand tray or art or it's called a bop bag, right?
Yeah, bop bag.
Yeah, a bop bag or fidgets, dolls. There's so many different ways of play within the room.
Yeah. Yeah, so all the toys in here are curated, not collected. So they're here for a therapeutic purpose.
I love that. What are some child-based issues that parents might bring their kids in for therapy? How do parents know if therapy is something their kiddo needs?
Sure. So I would love to say, like, let's be proactive about everything. Like if you see something might be happening, you're wondering and kind of curious, like, who could they use some help? Great. Yes. Insurance might prevent that. And we'll get into that in a little bit. But more or less, if you're feeling, I guess the standard would to say, when can parents kind of know, like, hey, now's the time, like now's the time to, pull that trigger. Usually we look at functioning. So functioning in different areas. So how are they functioning socially? Are they having trouble with keeping friends? How are they functioning in the school environment? Are they having trouble doing their work? Are they struggling with, just being part of their classroom and being able to engage in the academic environment? At home, are relationships being impacted? Parent relationships being impacted? Is there a struggle there? Is there also like emotional difficulty there? Is there a lot of meltdowns? Is there a lot of shutting off? Is there a lot of anger outbursts that seem not to be developmentally appropriate for their age? So those are all kinds of some signs and signals. Kids can go through a period of adjustment to something and exhibit these symptoms at times. I would say if it's lasting more than 2-ish months, then there might be something that play therapy could help.
To help them process, since they probably don't have, I think as you were saying earlier, they don't have the words to express to parents, I am anxious, I am frustrated, even I am being bullied or I don't feel safe at school. They may not have the
Ah,
words, so they actualize it through their behavior.
exactly. Yeah.
Mhm.
And so that's what is happening in the room is the kids are using these words, which are the toys, I guess, if you
Mhm.
will.
Mhm.
Mhm.
And so they're using that to process. And what do you expect
Mm.
this process to lead to? Like, what were some outcomes that you'd hope to, I guess, see? Because they're coming in, there's maybe behavioral, emotional issues. They have them actuated through play. What I guess is the outcome,
Or the goals.
the
Mhm.
goals? Yeah.
Yeah, I guess every goal is a little bit different for every kid and every family, right? So, to kind of put that in a context, when I'm doing an intake and the parents are, presenting with their chief concern, like what is it that we're seeking therapy for? I really drill down on the very, very specifics of what it is that they're seeing, how they're defining it, and what that behavior and emotion looks like for them and their experience of it. So I get that baseline, and that's where we take our goals from, our treatment planning from. So, first, a lot of kids who come in here, it's a lot of big feelings, a lot of meltdowns. They might be happening 2, 3 times a day, multiple times a week. So we're looking at the duration of a symptom, the frequency, the intensity of it, um, and we get those baselines. And then when we're having parent sessions along the way, we're checking back in on those baselines to see, are we shifting and changing anything there? And it's not an absence of the behavior or the emotion that we're looking at. We're looking at a shift in it. So it can look like, yeah, they're still having meltdowns, but it's only maybe 3 times a week as opposed to 10 times. So that's how we're getting those progress indicators in there. It's not the absence of it. It's the, hey, we're seeing progress in this direction.
So some coping for those kiddos. So learning how to regulate their bodies, that kind of
Mm-hmm.
piece. How much are parents actually
Yeah,
involved
yeah.
in this process too, Tracy?
It all depends. So it depends on the type of therapy that you're engaging in within that play therapy realm. So for me in particular, I'm an individual play therapist. So I'm doing individual sessions with the kiddos, and then I'm doing parent sessions. Usually the parent sessions, I say it's at least once a month. That's like the base model that we're checking in. We're developing some strategies for at home, helping them troubleshoot and understand the behaviors and what might be underlying some of these behaviors. That's a big piece of it. Some other parents need more support than that. And I might see them every other week, offsetting from like their kid. It would be them and then their kid, them and then their kid. So that's how I work. But there's other play therapy models that are more intensive where a parent is actually in the room. Thinking things like parent-child interaction therapy, like the child and the parent are in the room at the same time.
Yeah, because I imagine, working with the child, they go back into the home that might be causing the stress. And at what point do you start involving the family and saying the skills that we're learning here, how they're learning to use these toys to regulate? Did they learn that as a parent, as like, we can take this home with us and also?
Yes. Yes, for sure. In those parent sessions, what I really focus on is kind of taking the generalities of what's happening in the play therapy session, kind of looking at what's underneath the behavior, because you think of a behavior as a symptom, right?
Right.
And what's underneath it is what we want to address more so is the underlying unmet needs, psychological, physical, emotional, sensory. There's so much underneath that could be causing. So we kind of have those conversations about, hey, here's the behavior, but that's not the end point. We talk about what's underneath it. What could we figure out? And we have those conversations with the parents of teaching them like, hey, like, is this what you're seeing? Okay, if this is what we're seeing, then let's kind of develop some strategies at home to help integrate some of this knowledge that we're gleaning from this to help you guys with, those parenting pieces. Does that kind of answer the question? I know it's kind of
Yeah.
roundabout and very
No, it
quick,
makes
but
sense. I mean, there's a lot of questions. It's very fascinating. I've seen it very effective with children.
Oh yeah.
Are in this process, are you also assessing as a clinician? And I guess my mind is going to trauma and how kids act that out.
Yeah. Oh, yeah. Trauma is its own subspecialty in and of itself. I like to say that I'm trauma informed, but I know there's far greater therapists who really delve into this, and this is their bread and butter. But yes, the answer is yes to that. So if I'm assessing to see if like there's a trauma or some underlying other issue that isn't necessarily in my wheelhouse, then I'm kind of always looking at those assessments and seeing if there's something else we can add in there.
And what would that typically look like? I know with the little bit that I experienced when I was working through my master's, one thing that we saw was they would like use dolls in a sexual way, and then that made you think, oh, what might be happening? What do you typically see that you're like, oh, there's potential trauma here?
Yeah, honestly, it's not one particular play behavior that always points to trauma. Play behavior does need, I mean, there could be some really like clear cut and dry textbook stuff, but we rarely kind of see that. It does happen, but it can be a bit rare. It has to be considered with the context. So what do we know about the background? What do we know about, do we know if there's trauma? And if we do, then, how is it playing itself out in here? I think a lot of the time with kiddos who've experienced trauma, we tend to see the behaviors outside of the playroom. So we're seeing it at school, we're seeing it at home, we're seeing a lot of emotional dysregulation. Kids who are activated or triggered very easily for things that just don't make sense to the outsider. Attachment styles. But yeah, sometimes you will see kids act out or demonstrate a trauma that they have experienced. And honestly, yes, I can see it in toys sometimes. But also, I'm kind of considered a toy from the playroom too. So I'm not like an impartial observer kind of sitting in a corner. I'm interacting with kids. So sometimes what will happen is I will be involved in the play, and it's something called the setup. So I am set up to be put in the position that the child has been put in, and they need me to experience it. So I will sometimes be handcuffed and put in a corner, or I will be made to sit and be not able to move or breathe or blink. So they set me up to feel that helplessness, that inability to control. So I often look at that also as a sign of what is this kid working through, and could it be trauma related?
So through this process, you're assessing, but they're also gaining skills and learning how to process through, both on a physical and emotional level.
But I think about, Tracy, the training you've had to have to be here. Because as an adult therapist, this is so foreign to me. Often people who aren't therapists think, if you're a therapist, you can treat anyone, any issue, anytime. And this really speaks to specialty, to training, right? I would be of zero help in a child therapy space because it isn't something I'm trained in, right? And so can you speak a little bit to your training too? And if parents are looking at child therapy, how to know which therapists could be a good fit or are best trained or that sort of thing?
Sure. Yeah. So when you guys introduced me, you reintroduced me as a registered play therapist. So I have that extra credential in addition to my license that shows that I've gone through the extra steps to be fully trained in play therapy according to the Association for Play Therapy. So that process looks like, well, when I did it, it was a bit different. They've changed some of the criteria now, but it was at that time like an extra 150 CEUs and supervision. So I think I had to do, it was like 700 extra hours of supervision on top of it over at least a 2-year period. Now they've changed it since then. They've really structured it differently where you have to do it in phases. There's certain courses that you have to take in certain phases, like basics, history, like it's very structured. it was semi-structured before, but yeah, it is very structured now. They want to make sure that you're not just going and taking some random course in play therapy that might be an intro and then calling yourself a play therapist, because there's so much more to it than that.
And it happens all the time where people say, I specialize in trauma, I specialize in play therapy, I specialize in women's health, whatever.
What do you mean? I'm a behavioral parent.
And they don't have the training, and that risks doing more harm than good if we aren't trained in a quality way.
Yeah, and you talked about 150 credits, and I think just to give some perspective, that's a lot of time that somebody is spending to gain extra education in a very specialized area. This isn't let me watch a 30-minute video. This is being watched.
Yeah,
and this is over a couple years. Like another master's at some point on some of these. So
yeah, and you got to renew the credential every 2, and then you're doing more CEUs on top of that. And I think it's somewhere around, I catch me lying because I do it and I forget it, but I think it's like 20 to 40 CEs renewal. So you have to, and they're specific about what it is that you're doing too. Like it's ethics, it's the basics, it's the special populations. Like you need a well-rounded CEU.
So what can parents look for if they're looking for a quality therapist? How do they know if, when someone puts out their shingle and says like, I'm a child therapist or I'm a play therapist, what are they actually looking for? What are some markers?
So some markers that you want to look for, and the Association for Play Therapy also suggests this. So that's a great resource. First and foremost is the Association for Play Therapy. They will tell you what to look for. They are the advocates for this field. So you are looking, if you want a true play therapist who has the credential, you're going to ask them, like, what are your credentials? What is your training in play therapy? They should be able to produce it. There is a certificate. If you want to find a registered play therapist in your area, the Colorado Association for Play Therapy has a website that has listings. We're all listed in there for the most part. Now, there are some people that do have a lot of advanced training and certifications in play therapy. They just didn't pursue their RPT. So they still offer some value into the world of child therapy. For whatever reason, they may not have done the CEs, or they haven't done the supervision, or didn't do all the pieces, but are still highly trained. So I would say you're looking for someone who has, a few years of training, that they have a well-rounded training background, and it's not just one type of therapy. Yeah, I would say, what's the training? What's the training? And if it's only 1 or 2 courses, then no.
Yeah.
And even like, I would imagine looking into their space, right? Is there a wide option of play tools in the room? Are there options for regulation in the room? That kind of piece too, I'd imagine, is huge.
Yeah, exactly. I would say most play therapists were also trained in how to set up a room, what should be in the room, like what the toys we have. So there should be a wide array of therapeutic toys. Someone who has a cabinet full of games, that's not what you're looking for. So you should see things like, if you look around my room, you will see things like sand. You will see things like nurturing toys that are like baby dolls and stuffed animals, doctor kits. You will see dress up clothes. You will see things like a dollhouse. A dollhouse is pretty standard in a play therapy space. You'll see art. You'll see usually some opportunity for regulation. As I'm looking around my room, I'm like looking at all the things like the bot beds, the yoga balls. Yeah, you'll see those different types and categories. Building things like Legos and construction items as well are something you should be able to see on there.
It's like a really
not
safe
a lot of
space.
You shouldn't see a lot of electronic toys that have a lot of lights and sounds. The toys in here are meant to engage the child in their own imagination and creation process. And sometimes those newer toys that are like all the bells and whistles that do all the things that talk for you are not conducive to that. So the toys in here, a child is able to project what they need onto it without it telling what it should do, if that makes sense.
Mm-hmm.
One question I think people will be curious about is, what is play therapy effective at treating?
Yeah, the research supports a wider array of issues that it can treat. Anything from ADHD, anxiety, depression, emotional dysregulation, things like transitionary type of things like divorce, grief, and loss. Let's see, neurodevelopmental disorders, like I said, ADHD, behavioral issues, OCD, trauma.
It's fascinating because I think about it as an adult therapist, right? It treats all the same issues that adults might face, but in a language that's attainable for kids, right? If I sat across from a 3-year-old and said, well, how does that make you feel? They're not going to know what to do with that. Half the adults don't know what to do with that, right? And so I think of it as anything as adults that we're treating. I imagine you're treating the same for kids, just in a different way. And often for parents, we'll hear things like, my kids don't need therapy. I do, like I've got real stressors, but my kids don't. They're just kids. It's fine. And we kind of minimize kids' mental health and also minimize the treatment that they could really benefit from. Whereas adults, we easily justify it. Do you see that, Tracy, show up in your?
I know it's an issue. It's just when people are showing up to me, they're already
That's
on board
true.
with it for the most part, right? Like they're already pulling the trigger. They're like, yeah, we need to do something. However, I do at times have like a dynamic where one parent will be like, yes, we need it. And the other parent's like, no, we don't.
Yeah.
So I'll see it pop up in that way. But yeah, it's like, oh, they don't need it. It's just a transition thing. They'll get over it, or it's normal for a kid to feel these ways, or actually maybe not normal and they're just minimizing it. But
True.
yeah, it does pop up, and I have to do some education pieces around that to help them understand what it might look like for their particular child, and how to know, going back to that piece of how do I know when therapy would be an appropriate fit? Like, here's how we know. And kind of helping them understand that, yeah, no, this can be proactive even too, and not necessarily reactive in its nature.
Do you ever encourage the parents or other family members to also get support? Because I think back to like some of my training and stuff, and parents saying like the fix my kid kind of model of my kid's acting out.
Yeah.
It's all my kid. It's not me. Do you ever encourage the child's family or system to also seek support to create effectual change?
Yeah, that's that classic of like, hey, it's not me, it's my kid. Like, here's the black sheep of the family. They are the identified, client. Like, it's nothing I'm doing. Kids are part of the system. No, that's not parent blaming whatsoever. It's just they're part of the system, and there's dynamics that happen within that system. And I think even as a parent myself, I need support. Like, I need support in learning how to parent my own kid at times. Like, there's a sense of humility that comes with this. Like, hey, like, it's okay not to know, and it's okay to get the help, and it's okay not to be perfect. And yes, if this is hard, then yeah, let's go get some extra support for you. Even if it's just practical, or if it's therapy in itself. Is it respite? Is it, reaching out to the community and getting resources? Is it something so you're not doing this alone as an island, because parenting is hard.
So hard.
It's a lot of weight to bear.
Yeah, and for me, this process and having you talk to us about play therapy has been a help. Just inform people that play therapy is an option, and to destigmatize it, because I think a lot of people are like, well, it's play. Like, what are you getting from play? And it's highly, highly effective, as you talked about, and it can treat a wide array of potential disorders. And so I really appreciate you kind of sharing about this and helping shed some light on what this process looks like, what a session looks like. Are there any, I guess, tips or take homes or things that you feel like are important for our listeners to know about play therapy?
Sure. I think, and to kind of jump off of what you just said too, Greg, about like it's just play. Like sometimes parents do think like, oh, they're going there just playing. Like they're not being productive. It's not effective. Yes. I think that's a piece that parents need to know too, right? Like play is fundamentally important in developing so many skills as a future adult. Executive functioning skills, problem solving, creativity, collaboration, all those things can play. And when done in a therapeutic environment, it helps facilitate those in a more, I guess, concentrated way. So yes, knowing that play therapy is not just play. There's a lot of therapeutic processes that go on in there.
And assessment.
But also, what was the other part? Yeah, and assessment too. Like I'm constantly assessing to see if there's something else going on here that play therapy can't address, because that's a part of it too. Sometimes it's, adjunct therapies need to be added, and there needs to be a lot of support put in there around kiddos, like OT and nutrition and medical issues. I want parents to know that play therapy isn't always a one-stop shop. Like it's a part of a process. It is, especially for kiddos who might be struggling with ADHD symptoms. This is part of a larger process that's going to be ongoing. Play therapy can't cure ADHD symptoms, but it can help with other parts of it. But yeah, I think if parents are looking to further into play therapy, kind of understanding what the process looks like, being educated about the process, asking the questions about the process, finding the right fit. Not everybody's going to be the right fit for your family, and that's okay. There's no shame in that. Just keep trying. I think, yeah. I don't know if I answered your question. I went down a rabbit hole there, Greg.
No, I think all that's helpful for the parents, especially just explore it, get to know it more.
Yeah.
It's not just play, as you said. I can't stress that enough. I mean, there's a lot of processes that are happening at a therapeutic level. There's assessment happening.
Just in a way they can connect with. And what we know is kids, when we take care of kids and teens' mental health, they're better as adults with their mental health, right? So if we just say, well, they're just kids or they're just teens or, it's just school or whatever, and we shirk it off, then they're going to be sitting in my chair, Greg's chair, as adults because they don't have the skills that they need or the support that they needed and might have subsequent trauma. They might not have the self-regulation tools that they need to be a functioning adult.
Yeah. And this is a very prime, I think, developmental age to work on these. And we talked back to some previous episodes where we talked about compassion, and the parents have to have compassion. Well, that's hard because they didn't learn these skills and weren't engaged in like play therapy or other modalities at this time to learn the skills to regulate
those generational patterns. And they exist in mental health, right? If I'm really anxious, I might model anxiety to my child. And so it's not just treating her anxiety or treating mine, but treating the system.
Wait, might? You do?
Yeah. Come on.
Don't we all have a little bit?
I tell people it's good. It's what gets you up in the morning and also makes you make your nails, but it's fine. It's fine. But really treating it systemically.
Yeah. So, sorry, go ahead, Kim.
Oh, no. I was just going to say treating it systemically is so important. Really quick, Tracy, can you speak to also, does insurance cover this for families? How can they manage costs, but also find someone, that piece?
Yeah. So most insurances cover mental health care, right? I think that was like a law that was enacted back in the Obama administration, right? So I guess the issue with insurance is it's a double-edged sword. Do you have a good plan is the question. So yes, it is covered, but also know that each individual plan is going to have things like deductibles and co-pays. So I know I have some families who are opting to use insurance, but they're paying the same out-of-pocket private pay rate they would be because they're having to work off a deductible. So yes and no, it is covered, but you still can expect some expenses. I think you can always go to your insurance company. They can provide you a list of referrals. Potentially, I've had the experience that they don't have up-to-date referrals for the most part with insurance. So sometimes it's a matter of searching around the internet, maybe using something like Psychology Today with all the filters in it that can help you find a therapist that is a network with your insurance. But yeah, insurance does cover it. It is a covered service. But also there's people who want to play, just out of pocket for it and not use their insurance benefits. So that's also an option too.
I tell parents when because I work with the adult part of the system, right? And I often refer to play therapists for kiddo issues. And they say, well, is it really worth the cost? And I ask the question, can you imagine a night without a tantrum? Can you imagine your kiddo sleeping in their own bed? Can you imagine your child not struggling at school every day, not getting calls from the principal? Yeah, that is worth the cost, right? As a parent myself, when those periods come where it's really hard with our kids, to have that peace happen within our home, there is no price tag on it, right? And we know that play therapy is effective
Yeah.
at helping to treat these things.
Yeah. Yeah. That is also something that parents do struggle with, right? Because it can be costly to access these services. They're there, but like at what cost? And it can be a struggle at times because play therapy is a process that's not like an adult process. So the expectations we put on an adult therapy process are going to be different from a child process.
Very much so.
So yes, it's an investment, but also knowing like, hey, like we're not doing 8 to 10 sessions of verbal cognitive behavioral therapy here. We are potentially doing, if we're looking at the research, we're looking at 20 sessions before we're seeing some of those changes. So it's a different process, and knowing what the investment is going to be important for some parents to know, like, hey, this is going to be different. It's going to look different. Don't expect a big change in 2 months. So the investment is.
Well, the outcomes can be huge.
Yeah. Mm-hmm.
So Tracy,
Yeah.
Before we wrap up, any other tips or things that you think parents should know that are listening?
I think so much. I think there's so much pressure on parents. And understanding in and of your own parenting process that it's okay not to have all the answers. It's okay not to parent perfectly. Who does? I'd like to meet that person and call them a liar because it doesn't happen. It's knowing like, hey, it's okay. Like this, I think some parents come to me in a state of a grief process of like, this isn't the relationship I wanted to have, or I'm grieving for my child because their life is hard right now. And knowing and understanding, like, yeah, it's okay for it to be like that. And us therapists are here to help. And it's okay to reach out and know, like, hey, like, I don't got this, but I'm going to help you try to figure it out. Yeah, I think that's one of the biggest things I would want parents to know, that it's okay not to know and it's okay to look for the help.
Mm-hmm. Powerful message.
Yeah. Yeah, we really appreciate you sharing all of this with our listeners and us. I mean,
this is not my wheelhouse.
Either, so.
Yeah. Hey, couples is not mine. I don't want to touch that with 39.5-foot pole. I'll reach that all day long. I don't want to touch that either. So.
Well, this has been Relationships Inside Out, where today we are joined by Tracy Main, a licensed professional counselor and registered play therapist, to tell us all about child-based therapy. And one thing to add really quick, remember, play therapy is more towards our younger kiddos, right? Our 10, 12 at the most, and younger kiddos. Yeah. This doesn't even speak to teen-based therapy, which is a whole nother wheelhouse. But she spoke to how impactful this can be. If anyone has any questions for Tracy, questions for us, topic suggestions, please feel free to email us at relationshipsinsideout@gmail.com. Thanks so much, Tracy.
Thank you.
No problem, guys. Thanks.